So, before going in how to perform the resuscitation, it's important to know what happened in the normal situation for a newborn. What happened, what are a series of events that happen normally and physiologically in any newborn, whether he is at high risk or not, whether he is premature or term baby. So the first challenge that the baby undergo is to the rapid changing. It may happen at just moments from an organism with a fluid-filled lungs, and depending completely on the placenta for the respiration and for gastric exchange, he will rapidly change just moments to a separate being with an air-filled lung to overcome the process of the respiration, the gas exchange and the ventilation and perfusion. So how this process can happen? What can aid in these events? Lung filled with fluid completely, then it will be aerated. So the fluid, where it will come? When you're fluid. During vaginal delivery, and I think I explained this before, during vaginal delivery, there is a time at birth for the fluid to be decreased. So the lung cells or the pneumocytes start to decrease or start to stop producing the fluid. Firstly, from where the fluid comes? It comes from two sources. The alveoli itself produce fluid, and the amniotic fluid, it always will be ingested, coming inside the lungs, and the baby will urinate it again in a process to maintain the normal amount and circulation of the amniotic fluid. So, at the time of birth, because of the vaginal delivery, take time to happen. First stage, second stage, and etc. So, this time is enough to give an impulse for the alveoli to stop producing this fluid. This is the first thing. The other is that the baby, when he passes through the birth canal, he will expel an amount of fluid. So in term baby, it may be about 35 ml. يعني نص استكان تقريبا. 35 ml. It will be expelled. So this is one of the percentage. Now, what happened also? The circulation and the lymphatic system, it will start to reabsorb the interalveolar fluid. While if the delivery happened by the cesarean section, and especially the elective cesarean section, so that's what I mean, without labor. So there is not enough time for this fluid to be reabsorbed. That's why this fluid will be retained inside the lungs, inside the alveoli, and inside the fissures between the lobe, given the condition called transient tachypnea of a newborn, until the fluid takes its time to be reabsorbed, so the condition will be improved. But this has not happened or unlikely to be seen in the normal vaginal delivery, especially if it is not precipitous. What do we mean by precipitous? Precipitous delivery. This means the rapid delivery, especially in the first and second stage of labor. So, look at the first spontaneous breathe, how it will be regarding its pressure. In healthy baby, the first breathe, spontaneous breathe, may be of a negative pressure, between -30 to -90 millimeter of water, centimeter of water. This is high pressure, high negative pressure. It is more than 15 times of the pressure needed for maintaining or for continuing breathing. So why it is more than 15 times? This is to overcome This is to pass over an obstacles, over and something preventing the spontaneous breathing from happening. Like what? Overcome the viscosity of the fluid filling the airways. Fluids. So this will, you want to aerate fluid, disappear, resolve, and replaced by air. Second is the surface tension of the alveoli or the lung and the elastic recoil of the alveoli, and resistance of chest wall and lung and airway. So this process will be so difficult in preterm baby because the elastic recoil is not fully mature. The surface tension it's not fully mature. And why the surface tension is not fully mature? Because of deficiency of surfactant. Very good. And there is a disproportionate between the movement of the lungs or the alveoli and the movement of the chest wall. We call it the flail chest wall. Okay, there is a discrepancy between them. So the problem is more difficult in preterm babies. Now, the further breathing will be with the normal pressure. So after delivery, a term baby usually takes its first breath within 60 to 90 seconds of a clumping or obstructing the umbilical cord. This is mean separation of the umbilical cord from the placental side. So this time is enough to take the first breathing. This is for the normal spontaneous breathing, 60 to 90. So this is, okay, the time that is needed for the healthy term baby. Now, what are the major stimulants to start respiration or to take the first breathing? Major stimulants. Hypoxia. Very good. Hypoxia, physiologically, normally, it is essential to start the spontaneous breathing. But if it is severe or it is prolonged, it will be an obstacle against the breathing or against maintaining the breathing. So hypoxia, because of what? Because of cessation of the O2 supply from the mother, separation of the umbilical cord, or clamping, or separation of placenta, and the physical stimuli. Now the baby is out of the womb, artificial womb. It's mean the uterus. Now the baby is out of the uterus. So the physical stimuli, such as the cold air or physical discomfort, like birth trauma or something like that, it's not mean a significant birth trauma, just touching the baby gently. It may be regarded as physical discomfort. This again a major stimulant to start the breathing. That's why if the baby cannot breathe, what we will do for him, we will stimulate by so just the touching him gently. It may be a physical discomfort for him, but it will be a major stimulus to start the breathing. So this is the normal happening in the baby, in term baby especially. Now, for example, in a 3 kg baby, up to 100 ml of fluid is cleared from the airways following the initial breaths. So I'm going to get 35, about 35, expelled through the mouth while the baby passing through the birth canal. And the other, it's cleared by what? By reabsorption following the initial breaths. Now, this process, how this process is aided to clearance of the fluid. It's need what? And high pressure ventilation or high pressure expiration and prolonged with full inflation. So what is the result? Is crying. In crying there is full inflation and there is a prolonged expiration and with high pressure. So this is the crying, this happened by the crying, and this will increase the residual capacity of the lung. This will increase the residual capacity of the lung. So that's why the usual and the routine question. is the baby crying or not? Crying, it means better than just spontaneous breathing, because it increases the functional residual capacity of the lung. All the lung will be aerated by crying, especially if it is a high crying or if it is take a time to happen. Now, this is the normal physiology. This is what happened in or in each baby, especially the term baby, and this is what happened without interference. Now, sometimes for one reason or another, the hypoxia decrease O2 supply, decrease the blood supply, it will be severe, more than the accepted, more than to playing a role of stimulus, or it may be prolonged. So the baby will undergo a condition called birth asphyxia. So what are the physiology of birth asphyxia? What happened in babies with birth asphyxia? How the body responds to birth asphyxia? First, if you see here, if the hypoxia happens for one reason or another, so the response, the initial response, it will be a period, trivial time of rapid breathing. This is the initial response. Rapid breathing. During that time, the heart rate, it will increase with it. And the blood pressure, it will increase also. Then, if the hypoxia, it is not resolved, continuous. So, the baby will stop breathing, entering in a period called primary apnea or initial apnea. In that time, in the primary apnea, the heart rate starts to decrease, but it is still within the accepted level. The blood pressure is also start to decrease, but it is still with accepted level. So what about two parameters also, which is the CO2, the PCO2, and the pH? What do you think what happened in this period? For the pH, is it increasing or decreasing? Decrease. So the baby will undergo acidosis. So what about the CO2? Increase or decrease? Huh? Increase, because there is a failure of gas exchange. This is a sort of acute respiratory failure. There is a hypoxia and there is a failed gas exchange. So the CO2 will be retained. And this is a respiratory acidosis if the CO2 increase. And the pH in general will decrease in two causes. The first is the respiratory acidosis, and the second is the lactic acidosis because of activation of anaerobic metabolism. Because this rapid breathing needs what? Need energy. So this will lead to accumulation of lactic acid. Now, the movement of the baby at that time. The movement of the baby, it may be start to decrease in the activity. The normal posture of the baby, which is he should flex all his limbs, he will start to be relaxed, to extending it. But there is a movement. In this period of primary apnea, we should interfere with to prevent. But the initial steps of resuscitation is enough to make the difference. If the baby is in the primary apnea, if the hypoxia is so severe, profound, or we didn't interfere at the appropriate time, so the baby will start to take gasping breathing. The baby this is the final attempt to maintain the life. How? By taking a gasping breathing. Gasping breathing, it means not like the rapid breathing. It means a shallow, weak breathing. During this time, the heart rate starts to decrease more. During this time, the blood pressure starts to decrease more. During this time, the pH will decrease, the acidosis will increase, and the PCO2 is also will increase. And the activity of the baby starts to decrease. The baby will be floppy. He cannot move the limbs. So, at this time, the baby will reach to the point that take the last gasp. After taking the last gasp, the baby will enter in the period of secondary apnea. In secondary apnea, the heart rate more decrease, the blood pressure more decrease, there is no movement at all, the acidosis increase, the PCO2 increase. And this secondary apnea or terminal apnea, it will not responding to the initial steps of resuscitation. Here at this point, we need what's called the positive pressure ventilation. We should yield a high negative pressure from us to aerate the lung, to start the, not just the breathing, to increase the heart rate. Because here the cardiac output is decreasing. It's inefficient, so the blood pressure will decrease. So at this point, the interference is by advanced resuscitation, by positive pressure ventilation, and the further steps accordingly, and it can make the difference for this. Now, this is another picture shows when the oxygen deprivation persists. So it is not playing the role of initial stimulus of the starting breathing. There will be a tachypnea, as we said. Then the primary apnea with reversible good stimulation, which is meaning the initial steps. Then the baby, if not interfered with, there will be a gasping, then entering the secondary apnea, and it is irreversible unless the positive pressure ventilation measures achieved or done. Now, this is again show the changes that happen on all aspects, on the O2, on the CO2, on the acidosis, on the heart rate, on the blood pressure, and of course in relation to the primary and to the terminal apnea. And you can see here at this point when we start with the positive pressure ventilation, so the changes will happen. The heart rate will increase, the blood pressure will increase, the acidosis will decrease, and the PCO2 is also decrease, and of course the PO2 will increase. So this is why the interference at the appropriate time with the appropriate way can save the life. Now, at birth, what to do? هسه احنا خلينا نفترض نفسنا وين؟ ما قاعدين بهاي القاعة. خلينا نفترض نفسنا we are and the وين لازم نكون موجودين؟ At birth, which is the place of birth, either labor room or the operating theater. So, what we will do for babies at birth? Firstly, we have to say, ideally, someone trained. Someone trained in a newborn resuscitation should be present at all deliveries. So, whatever the obstetric history, if it is a high-risk labor or it is with an average, someone trained in a newborn resuscitation should be available. طبعا, the neonatal resuscitation, it is our profession, pediatrician and especially the neonatologists. But other personnel can do it, starting from the obstetrician and the midwife and the nurse. If they are well trained about the resuscitation, they can do something to resuscitate the babies. So, now, but there are certain deliveries, certain labors have a high risk for birth asphyxia. Now لازم شو نسوي؟ نحضر أنفسنا أكثر. What are the prenatal risk factors? يعني this is from the history or from the events of labor. بدأت الليبر وده نشوف احنا زين events sequence, and we know this is a high risk labor or high risk baby to develop birth asphyxia. So starting with these group, this is related to the mother herself. The extreme maternal age, if she is less than 15 or more than 35. This is a high risk, so you should be ready to interfere with. Maternal diabetes mellitus, why? Two causes for the maternal diabetes to be a high risk for birth asphyxia. First thing is the macrosomic baby, large for gestational age, This is maybe at risk of birth asphyxia or the physical trauma or difficult labor. And because of the sometimes hypoglycemia aggravates hypoglycemia, it may be the result of birth asphyxia, but it will aggravate the birth asphyxia if it happens. But sometimes in cases of placental calcification due to DM so the auto supply it will be crucial. It will be diminished. Maternal drug use, of course, will affect the auto supply. Preeclampsia for the same reason, because of the placental calcification. So sometimes causes or prenatal risk factors related to the placenta itself, like placental previa or the placental abruption or premature separation of the placenta. Now, causes or risk factor related to the baby himself, like what? Preterm gestation. This is a high risk. Post-term gestation, again, this is a high risk, and multiple pregnancy. We have problems related to the pregnancy status, like malpresentation and abnormal line, meconium stained amniotic fluid, fetal bradycardia. يعني شو fetal bradycardia? Fetal bradycardia and decrease in the fetal movement. These are signs of fetal distress. This can happen during the labor. And premature rupture of membrane. So, these are prenatal risk factors. We should be ready with all facilities, with all equipment to interfere. Now, what are the equipment? So, where is the place? قلنا labor room, yeah, the operation theater, and of course in an ICU after transportation of the baby. Because in our center here there is a window between the labor room and the NICU, and it's immediately just a few moments the baby will be in our hands. So what are the equipment that should be available? It should be available at the place of resuscitation, and you should check it before starting resuscitation. First is ستيثوسكوب تروحون حتى تطلقون بها صور يعني معقوله بالريسستيشن ما اجيب منو قال ستيثوسكوب؟ اكو واحد قال ستيثوسكوب سمعت واحد قال ستيثوسكوب وشوف حكيها طريقه السؤال هم يعني. What we call this? This is called the radiant heat source. This is called the radiant heat source. This yielding a temperature, a high temperature, to warm the baby because of the risk of hypothermia. Hypothermia will aggravate all the problem. So, this is the radiant heat source. What is this? This is a mechanical sucker, and we can use a manual sucker called the bulb, syringe, or what's called the penguin sucker. Penguin, يعني تعرفون شو penguin? بطريق. This is a manual, and this is a mechanical. So, with appropriate size of catheters, especially the catheter size between 12 to 14, to suction of the fluids, of the secretions. And of course, in between, we have a face mask. The face mask, it could be a triangular, it could be circular. The matter is the size of the mask, not the shape. And it is preferable to be transparent, to see the response on the baby, on the lips and on mouth. Now, go on. What is this? Of course, this is the Ambu Bag. What is the abbreviation of Ambu Bag? Anyone know? Abbreviation of Ambu. A, it means artificial. B, M, manual. B, breathing, and U, unit. So its name. It may be a mask valve bag. Bag valve mask, because we have bag, we have a valve system in this point, and we have the mask. And it may be called Ambu Bag because of this reason, and we can call it a self-inflating, because when we deflate, it will re-inflate again, or can called a manual a bag for resuscitation. Now, what is this?
O2 source.
This is an O2 source. This is a central O2 source called the O2 hood, and it may be a cylinder. Cylinder also can give us an O2 source. What is this? هسه اذا قلت منو قال سكر راح يسكتون ما حد يقول. بالك اللي يعني شيء غلط انا No, this is not CPAP. This is not CPAP and this is not sucker. This is what is called a TPiece resuscitation device. This is used in preterm baby because it will overcome the high pressure yielded by the Ambu Bag. راح نجي ان شاء الله على considerations and preterm resuscitation راح نحكي عليها. This is يعني actually in our practice we have no TPiece, but we should learn the ideal. What is this or what are these? This is called the mouthpiece or oropharyngeal piece. This is to make sure or to make a patency of the upper airway. And what is this? Laryngoscope, and of course this is the endotracheal tube. The laryngoscope used for the neonatal resuscitation with straight blade, while for age especially more than 8 years or 3 years they use a curved blade. Here it's called Miller blade or Miller laryngoscope. Of course it's a direct rigid laryngoscope, and it's the size of blade it may be 0 or 1. 0, it's almost applied in all neonates because it's a small size. This is the endotracheal tube, and this is the uncuffed endotracheal tube. And there is an equation for determination of the size of endotracheal tube according to gestational age and according to the weight. إن شاء الله بناخذ الانسترومنت نحكيها. Now, what is this? NG tube for decompression. And what is this? Clamp. This is a cord clamp. What are these? These are equipment for the umbilical vein catheterization, including scissor, syringe, including the scalpel, and including the umbilical catheter, and also with the adhesive tapes or with the accessories. So this is equipment for the umbilical catheterization. Now, gloves, adhesive tape, and here is the roll of stethoscope, of course. And what is this? Very good. This is a pulse oximeter. This is not like the pulse oximeter used in older age. This is this is just to put on the finger, or sometimes it's wrapped around the wrist of the baby. So this is a pulse oximeter for neonates. Now, what are these?
Special blanket for warming the exothermic.
This is called the exothermic warming blanket, and this is called a plastic bag for more warming of the preterm babies to prevent the hypothermia. So this is used in preterm baby. طبعا احنا اللي موجودات عندنا هي اكيد عندنا radiant heat source, mechanical sucker, Ambu Bag, laryngoscope, endotracheal tube, the accessories for doing the umbilical catheterization. لكن ما عندنا exothermic blanket, ما عندنا a plastic bag. TPiece is also not available. طبعا البلس oximetry اللي عندنا هو that used for infants. Medication also should be available, and we should have a drug bag or box. So adrenaline, and its power is 1 in 10,000 norepinephrine, and normal saline, we can use it, and naloxone especially, or sometimes used, and sometimes we may need hypertonic and we may need also sodium bicarb, but this is unlikely to be used, so they are not essential parts of the medication used in the resuscitation. Even the naloxone, just in a few circumstances. Now, what is this?
Incubator.
No, this is not an incubator. Yes, this is an incubator, but with a special function. This is called a warmed transporting isolate. Because after doing the initial steps or the primary steps of resuscitation, you may need to transport the baby to a tertiary center. I mean, inside the same center, tertiary place and its service. So you should transport the baby in a pre-warm isolate transporting. يسموها بالخدش تروح للكية. زين؟ لأنه it should be isolated, it should be warm, and it should be sterile. Always sterile. Now, of course, we need a timer, because all the process is a time of matter. And just minutes, no, seconds can make the difference. Now, the question that is usually asked, is the baby cried immediately after birth? So, if we go to yes, so just the routine care is needed. While if the baby didn't, so we may need, or we need neonatal resuscitation accordingly. Now, what are the routine care? Routine care. Firstly is provide warmth. We should warm the baby. How? The environment should be warm. The room should be warm. Temperature, it may be, or it should be at 25. But in preterm baby, it should be higher. And that's why in preterm baby we may use exothermic blanket or plastic bag to yield more warming. So provide warmth is very important, because hypothermia, it will increase the asphyxia. Right? It will handle the response. Clear airway if needed, of course by mechanical sucker if needed. If there are heavy secretions, need to be cleared. Drying the baby is very important, because wet baby in warm environment is still losing heat. Okay? So you should dry the baby. And then monitor. Monitor what? The heart rate, the breathing, and the color. Because the color is indicative of tissue perfusion. Increasing in the heart rate and efficiency of the breathing, of course it will be reflected on the color of the baby. These are the routine care. But if we go to the neonatal resuscitation, of course the initial steps of resuscitation, that means all these, in addition to tactile stimulation, stimulating the baby. Then we may need assisted ventilation using the bag, valve mask, or the Ambu Bag, or sometimes we use the endotracheal intubation, chest compression, and medication. So the neonatal resuscitation, it follows the rule of ABC, but it is a specific in neonatal resuscitation. Yes, ABC, but the steps and the details of each step is different from that happened in the neonatal resuscitation at any age out of a neonatal period, even in the young infants. Now, the quick assessment of the infant condition. Now we are handling the baby. We need to make a quick assessment of his condition. مو قلنا نشوف يحتاج neonatal resuscitation or routine care؟ مو؟ زين. هسه احنا منو هذا اللي شبيه؟ اللي هو the dental cry. اللي يحتاج resuscitation. We should do a quick assessment. How? شوف ال respiratory effort. apneic, or gasping, or regular breathing. The heart rate, it is more than 100 or it is less than 100. Keep this number, 100. Then, a decrease in heart rate, it is an indicative of hypoxic myocardial depression. So that's why we say in the physiology of birth asphyxia, the heart rate will start to decrease. And the response will be increasing in the heart rate. So we will depend in the quick assessment of the baby and the response of the baby to resuscitation steps on the changes in the heart rate, more than the breathing. Because the response to heart rate, it will yield the efficient breathing, because increase in the cardiac output. So the gastric exchange, it will be encouraged. So the single most reliable indicator for the need of resuscitation is the heart rate. وراح نشوف هسه من نجي to the details. Now, we apply a program here in our center, and I think in all the teaching centers in Iraq. We apply the Neonatal Resuscitation Program, which is developed by the American Academy of Pediatrics and the American Heart Association. الخطوة الأولى، هذا الطفل وين لازم موجود؟ Under the radiant heat source. ماشي؟ إن هذا هو provide warmth. Radiant heat source يضمن لي إنه there is no hypothermia. أجي أسأل هذا السؤال اللي هو يعني مو أسأل يعني أسأل واحد. أنا لازم أعرفه. أو ممكن أسأل اللي هو شنو؟ Is it term gestation؟ ممكن أنا هذه على ما أقعد أسوي له assessment ياخذ وقت الطفل شيل نحطه بكرتون. إذا هي obstetrician نقول لي هذا preterm baby. مو تحدد لي هي الجستيشنال ايج. أنا أبغى breathing or crying. وبعد شنو؟ has good tone or not. يعني البيبي after birth الهيلثي لازم ايش عنده؟ عنده spontaneous movement. شو تكون عادة الموفمنت؟ flexion هي الاكتف موفمنت زين of the baby. فاشوفه التون tone for flexion اكيد مبين العبارة. فذني if all three ثلاثة term breathing or crying with good tone هذا ايش صار؟ healthy. شو يحتاج؟
روتين كير.
حطه بقية الماذا اذا انت واقف بليبر روم. ها؟ هاي الموجودة يعني بالليبر روم لازم هسه احنا قاعدين هيك. فهاي الغرفة بزاوية احنا قاعدين فيها. روتين كير احنا قلنا provide warmth, clear airway if necessary، وبعد شنو وياها؟ try ومونيتور. زين؟ هذا اذا كان all these three. لكن if one of these three missed ما موجودة. يعني لا يا هو preterm أو breathing
أو
or
summer flexion أو
ما عنده good tone. شو يصير بالطفل؟ شو يصحوا له؟ flabby baby أو يصحوا له limping. زين؟ إذا هذا يحتاج resuscitation. شنو الخطوة الأولى resuscitation؟ إذا نفس الشيء هو قلنا الانيشال ستيت. يعني وين واقف هسه؟ under the radiant heat source. الخطوة الأولى provide warmth، هاي خلصت. الخطوة الثانية شنو؟ clear airway if necessary. الخطوة الثالثة المهمة اللي ما ننساها هي شنو؟ dry from the head. زين؟ from the head all the body. شوفوا هاي الدراينج ايش سوت لي هسه ممكن للطفل؟ سوت له ممكن ستيميوليشن. هذه انا زين اذا انا اذا سويت له دراينج وبقيت التاول عند هم سويت شيء؟
لا هي هي
يصير واحد يتنشف بخاله ويظل لابسه؟ لازم خرخر. طلع لي منه هذا التاول اللي هو شنو؟ دراي ناشف. اجي هسه هنا اسوي ستيميوليشن. اذا ويا الدراينج ما صار عنده بريثنج اسوي له ستيميوليشن. وات از ذا ستيميوليشن؟ شو تقولين انت؟ انت لا مو انت شلون نسوي ستيميوليشن؟ انا ما دا اسمع ايش دا اشوف الحركه مالتك والحركه غلط. ستيميوليشن شو نسوي بخشمه؟ شو نسوي؟ هذا الستيميوليشن؟ فيري جود. هذا الستيميوليشن. خلي الاكسجين شنو هذا الستيميوليشن اكسجين؟ شايفين انتم بالمسلسلات خصوصا هاي لازموها هيك طاب 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 هذا كله هيك شيء وقع الطفل كسر راسه انتهى. لا ماكو هيك شيء. الريل ستيميوليشن زين يصيحوا له تكتايل ستيميوليشن. تعرفون شو معنى تكتايل؟ هو رابنج اون هيز باك هاي هالشكل او فليكينج شويه شويه اون ذا هيل مو طا طا طا. الطفل هذا عنده ترى عنده بين ريسبتورز ها لان مو معدل سام معناته ما يحس بالالم فعنده بين ريسبتورز. either rubbing on the back or flicking of the heel. زين هذه سرعه تكتايل ستيميوليشن. حد هاي الخطوه احنا وين؟ وصلنا في 30 سكند. هاي مهمه تعدي شنو؟ تايم. اشوف اسوي assessment for the baby. زين شنو هو الاسسمنت؟ شو اريد اباور؟ وبس الهارت ريت. انا بهاي الستيب احتاج تو انديكيتورز الهارت ريت ومن وياها البريذنج. فاشوف الهارت ريت تتذكرون شنو هو الليفل قلنا عليه؟ above 100 less than 100 او اشوف عنده gasping or apnea يعني. اذا لقيت لا take a breathe والهارت ريت مالته شبيه increase more than 100 يعني معناته this baby is responding to initial steps of resuscitation اللي هي بيها الاستيميوليشن. يعني هذا الطفل الابنيه مالته وش تايب اوف ابنيه؟ برايمري ابنيه. فيري جود. reversible برايمري ابنيه. زين؟ فاذا شفت هذا الريسبونس صار عندي انا هسه وين؟ بعدني بال 30 سكند انتبهوا. اشوف الباترن اوف بريذنج. labored breathing هاي العباره اللي نقول لكم عليها دائما بالهيستوري. labored يعني difficult breathing. زين؟ او شنو؟ persistent cyanosis عنده بعده هو داخل breathing والهارت ريت مالته صار more than 100 لكن still cyanosis. هذا الشيء يحتاج ممكن انه فد further resuscitation لكنه مو further step in depth يعني قصدي ongoing resuscitation. clear airway خاف يحتاج. زين؟ اوتو سبلاي اخليه له وممكن حتى اعطيه ممكن سي باب يجوز يحتاج بس هو بعد طلع منه ريسستيشن. هذا صار شو يصيحوا له؟ كير. فهمت شلون؟ طلع من الريسستيشن هذا صار اسمه كير. لما حصلت الريسبونس تو تكتايل ستيميوليشن ممكن يحتاج اوتو ممكن يحتاج سي باب يعني مو بس ياخذ اوتو باي ماسك او نيزل كانيولا ممكن اسوي له كلير اير. زين لكن اذا لا breathing and his color is pinkish ها وبعد شنو؟ والهارت ريت more than 100 هذا شو يحتاج صار؟ وش ما يحتاج هذا يحتاج بس just monitoring. صار مثل very good. صار مثل ذولاك اللي هم كانوا healthy. زين لكن اذا سويت هاي الستبز اوف tactile stimulation انا حاسه وين ما اقف عند level of or time of 30 seconds and there is no response. The heart rate less than 100 or patient gasping او apneic. هنا أنا وين اروح؟ تجي role of the positive pressure ventilation. Most of baby responding to the tactile stimulation, to the initial steps. Most of them. زين؟ small percentage يحتاجون شنو؟ وصل لهنا. How perform؟ الحين كلش مهم. هاي كلش مهم. هاي إذا نجحنا بيها ما نحتاج نروح to further step. وأكيد prevent the complications. زين؟ of prolonged hypoxia and birth asphyxia. How to perform it؟ احنا قلنا ideally someone trained احنا بدنا نحكي resuscitation فهسه resuscitation according to the NRP اللي هذا هو الالجوريثم مالته ideally 2 person performing the resuscitation. One يعني perform the major role or take the major role of resuscitation, and other is aiding him, assistant for him. فالمفروض شلون واقف هو؟ المفروض واقفين احنا بهالشكل هذا. احنا المفروض اوقف هذا radiant source، تخيلوا من هنا هاي شو اسمه؟ لازم يصير free access from this side. وانا دا اسوي resuscitation I should stand here against the head of the baby. اول شيء لازم انا حاط different sizes of Ambu Bag. Neonatal عندي واحد اللي هو 250 مول. اكو 500 اكو 1000 نيش ما شاء الله بيها. فلازم انا شو محضر؟ النيونيتال Ambu Bag اللي هي 250 مول تطعيم of air. ولازم حاط different sizes of mask. ليش؟ لأنه I should fit the mask on the face. زين. I should make a good seal on the face, because if I choose a large mask ما دا أسوي positive pressure ventilation، شو راح يصير بالأير؟
Escape.
leaking, escaping. زين. وإذا كانت small size ايش راح أسوي؟ إذا كانت small size راح يسوي obstruction of the air، يعني أحطها على الخشم بدل ما هي راح تفيد take a breathe راح يسوي obstruction of the nose. زين؟ فلازم أختارها الصحيحة. زين، جيت اختاريت السايز. البيبي لازم يكون in this نقول عليها posture. زين، in this position. هذا تشوفوه هنا position of the head is parallel to the chest. هذا شو يصيحوا له؟ يصيحوا له sniffing position. لا هو hyper extension ولا هو flexion. الفلكشن ايش راح يسوي لي؟ obstruction of airway. الهايبر extension راح يسوي لي problem in the breathing، ممكن يسوي لي problem in the spinal cord. اللي يحتاجه انا هو شنو؟ ها؟ sniffing position يسويه له اللي هو slight extension of the head. فهذا لازم. زين. شو اسوي؟ اقدر اسويها انا وحدي، وممكن اقدر اني الزم الماسك ويجي واحد يسوي الريسستيشن. اجيت خليت الماسك الابروبريت سايز. شلون اعرف الابروبريت سايز؟
نكفر الماوث والنوز.
لازم covering the mouth and the chin، بس ما نازل below the chin، ولا covering the eyes. هذا صار لارج. السمول اللي هو قاعد على التب اوف ذا نوز وما واصل للتشن، لكن اللي covering from the chin to the base of the nose والاي طالعه خارجه، هذا شنو؟ هذا هو الابروبريت سايز. اجيت خليته هالشكل. هذا شوفوا الامبو باج اللي هي قلنا 250 مول. اذا اسوي فول بريشر هاي تعطيني 30 to 40 سنتيمتر اوف ووتر بريشر. اذا اسوي هالف انفليشن ايش يعطيني؟ 15 to 20. انا ايش يحتاج اسوي؟ يحتاج اسوي ريت اوف باجنج يصيحوا له of 5 inflations in 15 seconds. 5 inflation in 15 seconds with full inflation like this. So 1 1 2 3 2 2 3 3 2 3 4 2 3 5 2 3. هاي ايش خلصنا؟ 5 inflations with full pressure in 15 seconds. At this time, I reach to the level of, or to the time of 60 seconds. خلصت. هذه 60 seconds شو يسمحوا لها؟ Golden minute. It is the most important minute in the life of a person, may extend to 100 years. زين؟ هذه أهم شيء حياة الإنسان. The golden minute. فأنت شغلك هنا وصلت to the golden minute to the end of it. سويت الفايف انفليشن، تجي هنا checking the response. هنا بالريسبونس صارت الريسبيريشن اوت اوف بعد ما استخدم as indicator. Only the heart rate. So if the heart rate is more than 100 or less. إذا the heart rate is more than 100, so there is a response to the positive pressure ventilation. شو راح اسوي هنا؟ راح ارجع باك ستيب. هذا كنت انا انطي هاي انفليشن وكنت انطي باجينج اوف 5 in 15 seconds. ايش راح اسوي؟ هاف انفليشن in 1 second، يعني راح انطي شويه شنو؟ رابيد باجينج. ممكن انطيها 30 seconds. زين؟ until the baby take a breath. ماشي؟ until the baby take a breath. اسويها 30 seconds. هيك مثلا. until 30 seconds. اشوف البيبي take a breath. ارجع على الخطوه لوين؟ شوف labored breathing or persistent cyanosis or لا صار شنو؟ pink with good breathing. اوكي؟ اذا الريسستيشن step forward, response step backward. زين. إذا after positive pressure ventilation there is no response. معناته الهارت rate is still less than 100. هنا أنا لازم شو أسوي؟ يصيحوا لها corrective steps of resuscitation. شنو هي corrective steps of resuscitation؟ أولاً ممكن أجي أباوع على الماسك مالتي. أخاف أنا ما مستخدم الماسك الصحيح. أخاف أنا ما مسوي good seal. أو أخاف the airway it's not patent. فشو أسوي أنا for the airway it's not patent؟
suction.
أسوي يصيحوا له jaw thrust. jaw thrust هو أسوي hyper extension of the neck والlower jaw is forward upward. زين؟ push forward and upward. شو راح يصير؟ open the mouth. زين؟ أجي أسوي resuscitation. هاي يصيحوا له corrective steps. ممكن انه انا ما كنت رابطه with O2 هو شيء يصيحوا له blended oxygen. شنو blended oxygen يعني؟ شنو معنى كلمة blended؟ ها؟ mixing very good. blended mixing. شوفوا هذا احنا قلنا من نشتغل تجيب الطاري O2 انا هسه؟ لا. لان هذا الاوتو بده يجي منه enough. الطفل ما يحتاج هايبر اوكسجينيشن. الطفل ما يحتاج هايبر اوكسجينيشن، الاكسجين اللي موجود داير مدايره كافي، بس المشكله هو ما ياخذ بريثنج على مود يستفيد من عنده، واضح؟ لكن ممكن هنا لا اسوي بلندد اوكسجين اللي هو موجود هذا الاير انسايد ذا باج وربطته اوتو سورس، يصير له بلندد اوتو. زين؟ فممكن هاي الستبز اللي احتاجها، وممكن حتى يحتاج اسوي انتيوبيشن. ممكن. ها؟
بلند شنو فائدة؟
اوتو. يعني هاي اوتو كونسنتريشن.
يعني بريشر زايد؟
لا ما له علاقه بالكوانتيتي، ساتوريشن. يعني ممكن يكون السبب انه ما اخذ الساتوريشن از نوت انف فور هيم. زين. هذه الكوركتيف ستيبس هم ارجع اسوي الفايف انفليشنز 5 باجنجز 1 2 3 4 5. خلصت هسه الكوركتيف ستيبس. هسه شويه I will be more humble in the response. كنت قبل ايش اريد الهارت ريت شو يكون؟
above 100.
هسه كلش نازلنا قبلنا. لازم الانسان يصير عنده مرات تنازل بالمواقف الصعبه. على مود مو يعني يتنازل على مود يخضع، لا يتنازل على مود يعبر. زين؟ اقبل هنا بيش؟ heart rate is 60 صار. below 60 more than 60. إذا لا والله after corrective steps it is more than 60 فممكن استمر بالباجينج further session of bagging until reach to 100. إذا عبر 100 شو أسوي؟ half inflation. وإذا صار البريذنج is okay فيحتاج just care أو monitoring، أو إذا بعد labor breathing ممكن قلنا نحتاج CPAP، نحتاج O2، نحتاج وهكذا. زين. إذا لا الهارت rate is still less than 60 as we said، هنا from this point يقول consider intubation. هنا أكون أحط ببالي إنه this baby need intubation، endotracheal intubation، ويحتاج بعد شنو؟ chest compression with positive pressure ventilation. فممكن ال chest compression I perform it directly on the baby or through the endotracheal intubation. كل اللي أسويه أوخر الماسك أربطه بالاندوتراكيال تيوب. زين؟ لكن إذا أنا أريد أسوي استمر directly أوكي. احنا intubation ما راح نراويكم إياها، لكن راح أراويكم how to perform chest compression. هنا يجي role of the assistant for doing chest compression. لأنه يعني for efficient chest compression it should be vital. شو راح تسوي أنت مثلا؟ أنت راح تلزم Ambu Bag in the same manner. الأذر ايش راح يسوي؟ راح يسوي chest compression. شلون يسوي chest compression؟ in this way. يعني يسوي pitch yourself. Pitch yourself. هذا السترنم. ها. Both thumb at the base of the sternum from both sides. زين. و supporting the baby by your fingers. وبعد طبعا الماترس. وتسوي الكمبريشن. وراح يكون بالشكل التالي. يعني هسه مثلا انا اريد انا اسوي الكمبريشن. راح اوقف هنا أنا مثلا. Free compression. Alternate with
one.
فلازم اكو شخص واقف شو يسوي؟ يسوي الفنتيليشن. السيشن ايش قد يطول؟ 30 سكند. زين ما عندي واحد اعوفه هذا؟ لا. شلون اقدر اسوي؟ هذا الامبو باك بيدي اشتغل بيه وشلون اسوي تشيست كومبريشن؟ ثلاثة وهكذا. زين؟ لكن هي ايديال لازم تكون باي
2
persons. ليش؟ واحد اثنين ثلاثة وهكذا. زين. هذا التشيست كومبريشن خلصته. اجي اشوف السيشن الواحد قلنا ايش قد يطول؟
30 seconds.
30 سكند. اجي اشوف الريسبونس.
Heart rate.
ها؟ اجي اشوف الريسبونس اللي هو منو؟
Heart rate.
الهارت ريت. If the heart rate is less than 60 or more than 60. إذا صار more than 60 شو اسوي بعد؟ ما يحتاج chest compression. اكمل على اليمن على الباقي لحد ما اصعد لل100 لحد ما اشوف البريذنج. اذا لا والله بعد still less than 60 يجي الرول اوف medication. يعني معناتها هذا الهارت صاير عنده severe myocardial depression. ماكو contractility يحتاج انطي inotropic agent اللي هو ابنفرين. انطي 0.1 to 0.3 مول اي بي. فالمفروض انا شو مسوي؟ اعطيه ثرو ذا امبليكال فين او انه اسوي كاثيتر ومنطي هي. واذا ما قدرت احصل فين شو اسوي؟ اقدر لا ها؟ فيري جود اندوترايكل بس لازم يكون الدوز يصير 1 مول. فانا اذا محاط له تيوب الطفل وما قدرت احصل له اي بي، هو الاي بي طبعا هو اللي يمشي اسرع. زين؟ قبل جو انتو ذا هارت فاقدر انطي اندوترايكل تيوب. شوف اذا ازود الدوز اسويها 1 مول. زين؟ انطي هي ثرو ذا اندوترايكل تيوب.
قصدك يعني
اي ادفعها بالاندوترايكل تيوب. يعني ادفعها تدري شلون بخه
انهاليشن.
انهاليشن. زين من اللنج يصير بي ابزوربشن ويروح للذهن. وبهاي الخطوه هنا أنا زين بنفس الوقت اشوف الريسبونس افتر جيفن ابنفرين. اذا البيشنت هارت ريت صار مور ذان 60 حصلت الاريدل، ما حصلته بالتشيست كومبريشن حصلته بايش؟
بالميديكال.
استمر بالبوزيتيف بريشر فنتيليشن. شو دائما هاي هي الاساس. زين اذا لا بعد ما انطيت ابنفرين وما صار ريسبونس ظل الهارت ريت less than 60 given another shoot of epinephrine لا خلاص once اعيد شو اسوي؟ chest compression with positive pressure ventilation. اقدر اعيده frequent session. each session is of 30 seconds. اقدر اعيده الى ان الهارت ريت يزداد. بس لازم احط ببالي شغلتين. ليش ما دا يصير ريسبونس؟ ممكن يكون هذا عنده هايبوفوليميا، ميجر هايبوفوليميا، بلاد لوس. ممكن صار عنده بلاد لوس ديورنج ذا ليبر فقد بلاد، او صار عنده ادرينال هيموريج. ايش احتاج هنا عشان انطي؟ resuscitation of the intravascular valve. انطي نورمال سيرم 10 مل بير كي جي. احنا هناك ايش نعطي البالص؟ 20. هنا ايش نعطي؟ 10 مل بير كي جي. وبعد ممكن يكون هذا عنده نيوثوراكس يعني عنده space occupying lesion prevent of the lung expansion. فماذا ياخذ البريدنج لهالسبب؟ وانا احط ببالي هذا الشيء. واستمر بالريسستيشن الى ان احصل ريسبونس بس to certain time راح نعرفه هسه. صار واضح عندكم شلون نسوي ريسستيشن؟ Is and position of the mask. You can see here this is the correct because it covered the nose, mouth and chin. This is normal size or a correct size, but position is wrong. And this is a small because this will obstruct. أنت تصير عبارة تنطي بس you will obstruct the nose. And this is large because it go out. It will escape out. So now, this is the correct position of the head. This is the sniffing position. This is deflection. شوفوا its effect on the airway. And this is the hyperextension. Also, it will impact the patency of airway. So the sniffing position is that important. If you didn't, you can do it. You can put something under the shoulder of the baby. So this is given a small or a minimal extension of the neck to be sure of the sniffing position is doing properly. Now, this is the sniffing position as we did. And this is how they perform the positive pressure ventilation by one hand before doing the chest compression. And here, شنو هذه? This is the jaw thrusting. So look at the start to open the mouth by elevation of the lower jaw forward. This is called the jaw thrusting, with slightly increasing the extension of the head. And here, ideally, it should be done by two persons. Now, this is the chest compression. You can see if we can do it alone or by two hands. So alone, here, I can do this alone. Or in this way, okay? Two fingers or by the thumb. Now, this is the chest compression if done alone. Now, I will go back to the pathophysiology again. You remember this is the primary apnea. In the primary apnea, the tactile stimulation, it may make the difference and the baby will respond. Then, the baby, if there is no interference or the baby is not responding because of the severity of the asphyxia, there will be a gasping breathing. It's usually 4 to 5 minutes. At this point, then the baby will enter to the secondary apnea, the heart rate decreasing, also the blood pressure. And in this point, assisted ventilation, chest compression, and the drugs. زين. At this time, صار باللactic acidosis سوت لنا decrease the cardiac contractility until reach to the point of cardiac arrest. شو احتاجينا؟ احتاجينا chest compression، احتاجينا drugs ادرينالين. اكيد هو البرايمري افكت وين يروح؟ المن؟ البرين. شو يسوي لنا؟ hypoxic ischemic encephalopathy. شوفوا ال benefit and the advantage of resuscitation and why the response to resuscitation to this way. هذه again will show the from this point يعني up to 10 minutes after the apnea or after the hypoxia, I mean, the brain damage will start. But in this point, resuscitation will increase the heart rate, increase the blood pressure, the onset of gasping breathing again will start. The acidosis will decrease from when acidosis 6.8 6.75 رجع صار 7.1. شوف البي سي او 2 بدا بيش 45 which is normal. بعدين صار up to 200. Then هاي وين مسويها هاي الدراسة؟ هاي مسويها على الريسس مانكي، ما مسويها على الهيومن. But to large extent it is like what happened in a human newborn. So the longer the duration of secondary apnea, هاي نشوفها. Longer of the duration. This means what? The greater the risk of the organ injury, and especially brain. Then. Now, what are the first signs of recovery? لسه شفنا شنو هي first sign؟ heart rate. واحنا اعتمدناه. وبعد شنو؟ blood pressure with improved perfusion. Of course, the heart rate increase معناتها cardiac output increase. فأكيد ال arterial blood pressure will increase. معناتها blood supply increase to the tissues. وراح نشوفها بالperfusion. فراح نشوف يعني resolution of what? of the cyanosis or even the pillar. Now, the time required هذه مهمة على مود أحسب ببالي من دا أسوي resuscitation. If I still the usual time for response or I am out of it. The time required for rhythmic, spontaneous respiration to occur is related to the duration of secondary apnea. فنكون نعرف هذا البيبي duration of his secondary apnea. لذلك يقولون for each 1 minute past the last gasp يعني primary apnea دخل بيها. 2 minutes of positive pressure ventilation is required before the gasping begin. 1 minute صار عنده apnea يحتاج 2 minutes of positive pressure ventilation. احنا ايش قد حكينا؟ seconds مو؟ ما طولنا minutes تمام ولا لا؟ 4 minutes is required to reach the rhythmic breathing. يعني أول شيء يبدي gasping breathing اللي هو irregular, ineffective. بعدين 4 minutes is required to reach the rhythmic breathing. زين. احنا سولفنا عن المسل tones start to decrease لأن يصير البيبي floppy. Muscle tones to regain it needs several hours. فممكن إن الطفل take breathing, his heart rate now within the average, and the breathing is regular and rhythmic. لكن شنو نلقى بعده؟ floppy, because this need longer time. Now, in the neonatal resuscitation program, this is applied in the centers or the societies or countries of somewhat high resources. That's why we said it is developed by the American Academy of Pediatrics and the American Heart Association. طبعا بريطانيا عندهم resuscitation council مجلس عندهم for resuscitation. باليوروبيان يونيون عندهم European resuscitation council. يعني up to 99% it is the same. ماكو فرق. زين؟ تعرفون امريكا يعني انترناشونال معناته. فلذلك احنا نستخدم Neonatal Resuscitation of the American Academy of Pediatrics. اكو شويه فد اختلافات. زين. لكن in low resources or developing countries. Problem على مود نجي احنا نسوي resuscitation. WHO affiliated with the AAP, American Academy of Pediatrics, putting an algorithm for helping babies breathe. This is more easy, this is more simple, and it is more applicable even by the paramedical staff. هذا simple احنا ما راح نتطرق له زين بس هو نفس الستبس. هم تشوف dry the baby, شوفه crying or not. If he is crying keep warm. and يعني راح وين؟ راح على الروتين كير. If he is not crying شوف محتاج هنا call for help يسحبونها وممكن حتى محتاج positive pressure ventilation. فهاي equipments needed for the preparation of the birth. So على helping baby breathe. ممكن يستخدموها هاي الصورة اللي تشوفوها this is an Indian woman. زين لأنه يعني يعتبروهم they didn't have the facilities. هو احنا ما عندنا كل facilities. Just to know it. Now, what is the percentage or what is the incidence of need resuscitation? يعني كل الأطفال دول يحتاجوا resuscitation. This inverted pyramid show that most of the babies, the vast majority of the babies, didn't need resuscitation. 85 of them, they will take spontaneous breathing within 10 to 30 seconds after birth. يعني معناته هذول ايش يحتاجون؟ Just routine care. زين. 5 to 10% require simple tactile stimulation. وين هذول راحوا؟ صعدوا ويا هذولاك. Just by tactile stimulation. The initial step of resuscitation. زين. لأن هذول وين بعتهم بالprimary apnea. تمام ولا؟ يعني الhypoxia is mild. Approximately 3 to 6% require basic resuscitation. هي شنو هي؟ الباج اند ماسك قلت النسبة. وإذا نروح إلى الchest compression with ventilation or drug or intubation شو راح نلقى؟ less than 1%. أصلاً شوفوا ذولا less than 0.1%. يعني معناته ايش قد؟ 1 بالألف. 1 in 1000 need chest compression and positive pressure ventilation. زين؟ إذا معناته هذا يصحوا له inverted pyramids. هاي هنا نفس الفكرة، نفس المعلومات. سوري. نفس المعلومات تساوينا أنه all need the routine care. The percentage start to decrease إلى أن نوصل chest compression with oxygen هم 1 بالألف، الأدرينالين هم 6 بال10,000، والvolume expansion هم شنو؟ 1 بال12,000. صحوا له inverted pyramid of need for resuscitation. زين. احنا قلنا it is objective way to resuscitate. من اللي يحكمنا؟ ناو بأمريكا وبريطانيا وكندا وبالصين، اللي يحكمنا هو منو؟ أبجار سكور. What is your information about أبجار سكور؟ شنو أبجار سكور؟ يلا يا كاظم، مو كاظم؟ يلا كاظم. What's أبجار سكور؟
يعني هو by American doctor على مود الاديرنس والريسبيراتوري يعني باص والجراس مال البيبي
Yes.
يعني activity.
شوفوا البداية تعريفه أهم شيء. It is an objective method to quickly summarize the health of a newborn. احنا قلنا quick assessment شو اعتمدنا؟ على الهارت ريت والبريثنج. هذا quick assessment. هسه ال quick summarization of the general health of a newborn. It is an objective method. يعني مو حسين قاسم يشوف يقول هذا تعبان، اسمك محمد يشوف يقول لا والله زين، ثاني يقول لا. يعتمدون كرايتيريا. زين؟ يعتمدون كرايتيريا، يعتمدون سكور، يشوفوه يطبقوه يطلعون بنتيجة واحدة متفقين عليها. زين. It is performed of course on baby at the 1 minute and 5 minutes. يعني 1 minute شنو؟ After end of the first minute. اللي هي هاي الجولدن minute اللي قلنا عليها. و after end of the 5 minutes. زين. The 1 minute score determine what? How the baby tolerate the birth process. هذا الطفل مر بسترس. Hypoxia, مو exposure to cold, physical discomfort هاي اللي قلنا عليها. How he tolerated. This is at the end of first minute. While the 5 minutes tell us how the baby tolerate the life outside the uterus. يتحملها لو ما يتحملها. زين. So this is the 5 minutes. Sometimes we need to do the score at 10 minutes, 15 minutes, and even 20 minutes after birth. I went with advanced resuscitation with severe hypoxia. Need further evaluation, not just 5 minutes. Of course, it is developed by an American anesthesiologist called Virginia Abgar in 1952. هذه شافت هي يعني انه قضيه خاضعه للمزاجات مثل ما يقولون. طبعا مو المزاجات الشخصيه، المزاجات العلميه قصدي يعني. زين؟ مو يعني يوم جاي ضايج ما متريق متعارك مثلا يقول له يلا هذا الشيء اللي ضده هذا شنو. لا. يعني يصير سحوله الكلينيكال جادجمنت. شوفوا احنا عندنا ان ميديسن عندنا اكو جايد لاينز فور management of some certain diseases. اكو عندنا شيء يصحوا له clinical judgment. Clinical judgment it's not usually wrong and sometimes it is the way and it is the only way the clinical judgment. ماشي؟ نحن نقول clinical judgment مو معناته انه this is always wrong. لكن in this point in this part of management لا. Clinical judgment it is wrong. It should follow the objective method. زين هسه الابجار تعرفوها انتم. A for the appearance. This is to يعني commemorate the Madame Virginia Abgar. The pulse, the grimace, the activity and the respiration. طبعا each of these signs can receive 0, 1 or 2. So the full score is 10 while the low is low until reaching to the 0. Now this is Dr. Virginia Abgar. We tribute her soul for her efforts in this point and in this field. Of course, this is the Abgar score and how we perform it. So this is just doing a checklist. يعني you have to know it, you have to keep it. لكن للسرعة إنه أنت عندك السكور بتشوف respiration absent, weak or strong تعطيك السكور وتحسب الريزلت. بالنتيجة راح تطلع number out of 10. زين. هذا نشوف when we say appearance it is blue all over or sometimes they be pale blue. This is the acrocyanosis and this is normal color. Grimace. Grimace is introducing a nasal catheter or NG through the nose and to see the response. So normally there will be sneezing, coughing, pulling away ممكن يسحبها, but the minimal response is by grimace. يعني شنو grimace؟ يعني مثل اللي يبكي الطفل شوي بس خلينا نقول عليها بالدرجة يحكمش وجهها يعني يحقق وجهها. And if there is no response, of course this is zero. التون شوفوا التون لازم شو تكون؟ active movement شو يصير؟ Complete flexion. The normal posture of a healthy newborn, especially the term, is flexion of all joints with respiration. طبعا نهاية ما نسوي السكور راح نسوي assessment. So if it is between 7 to 10, what do you think? This is a good health for the baby. There is no depression. ايش فوق السبعة حلو. 4 to 6 is moderate asphyxia, and 0 to 3 is severe asphyxia. Of course, this is at the end of 1 minute and 5 minutes. مثل ما قلنا. زين. هسه وين نروح failure to respond to intubation and ventilation. This is meaning failure to respond to resuscitation. Why? يعني some baby احنا قلنا most of طبعا صح ولا غلط؟ مو تمام؟ Most of need nothing and most of those needs راح يصير بيهم response. لأن انتم شفتوا اللي يحتاجون positive pressure ventilation 3 to 6%, بس اللي عبروا للchest compression ايش قد صاروا؟ 0.1%. يعني معناته من ذول 3 to 6% most of them وين راحوا؟ response. زين. Why sometimes we may face a failure to respond to resuscitation, especially when we reach the advanced stage, intubation and ventilation. First is it may be due to mechanical difficulties. So, what are the mechanical difficulties? And we should rule out the mechanical difficulties before thinking of other cause. لأنه this is preventable and correctable. So, like what? Equipment failure. Simply. شوف قد نعتمد عليها. ممكن حاجة تكون not functioning well. ما تشتغل بشكل صحيح. الفالف سيستم مالتها failed. أو إنه إحنا شو نسوي؟ إحنا ما نشغلها صح. شو ما نشغلها صح؟ ها؟
ما نلبسها زايد.
Endotracheal tube malposition. وين رايح ممكن؟ بالإسوفاجس. أنا أقول مسوي تيوب ودام في positive pressure ventilation وهو وين رايح لي؟ بالأبدومن. أو رايح وين؟ in one bronchus. رايح للرايت سايد مثلا. occluded endotracheal tube. secretions جمعت stuck causing blood. سدت لي التيوب. أنا شو أقول؟ تيوب ليش تو؟ ليش ما يجي؟ I should check it. Insufficient inflation pressure to expand lungs. قلنا the primary inflation لازم شو تكون؟ full pressure. أنا ما دام أعطي full pressure. فليش يصير response؟ مو؟ ما يصير response. Space occupying lesions in the thorax. This is also regarded as mechanical difficulty. Like what? An example. Pneumothorax, pleural effusion, congenital diaphragmatic hernia. هذه expanding on the expense of the lung. ما راح يصير expansion of the chest. ما راح يصير response. زين. ايش عندي آخر شيء؟ pulmonary hypoplasia. Where can I see pulmonary hypoplasia? In extreme prematurity. I can see pulmonary hypoplasia. يعني هي ايش؟ ماذا اسوي باللنج؟ هي ايش بيها؟ didn't responding. زين؟ هاي لا السيرفس تنشن ولا الالفيولاي ولا الالاستيك ريكويل ولا البلمونري. من اقول pulmonary يعني اقصد الالفيولاي والايرويز كلها. زين؟ يعني parenchymal tissue be hypoplasia because of extreme prematurity. فهذا ما راح يسوي لي في الريسبونس. زين. The other cause of failure to respond to resuscitation is profound asphyxia with myocardial depression. يعني احنا شفنا هسه 1 minute of the last of the يعني primary sorry the secondary apnea ايش قد تحتاج 2 minutes to start gasping with positive pressure ventilation 4 minutes to start with the rhythmic breathing. So إذا هو مثلا كان الطفل شو ناخذ له 5 minutes of terminal apnea ايش قد احتاج معناته؟ معناته 10 minutes of positive pressure يلا يبدي ياخذ بريد زين فمن تعبر ال 10 minutes تعبر ال 10 minutes واني ما صار ريسبونس. This is not my fault. Sorry, not my fault. زين this is not my mistake. المشكلة وين؟ profound asphyxia. زين بعد شنو؟ inadequate circulating blood volume. Hypovolemia. Shocked. Patient has acute blood loss. هذه همينة شو راح تسوي؟ There is no response. طبعا هو شلون انا اسوي re-expansion of the adequate normal saline and the dose should be 10 ml per kg. It should be infused slowly. مو 20 ml احنا مو عادة bolus نعطي 20 ml in neonate 10 ml is enough. So these are the causes why we may fail in resuscitation. عندنا هسه special considerations اللي حكيناه هو resuscitation in general. We have special considerations in certain infants. Start with who? تعتقدون؟ preterm. Preterm مش يحتاجون. Preterm they have more risk to develop hypothermia. لذلك شو يحتاجون؟ Minimizing heat loss will improve the survival. How? احنا قلنا temperature of the environment لازم تكون 25. Here it should be more than. بعد شو اسوي؟ زين؟ Pre-warmed sterile towel احضر. بعد use the exothermic blanket or the plastic bag اللي شفناها which is unfortunately unavailable. لكن ممكن احنا نحط من عندنا يعني ماكو مشكلة ممكن احنا نحط فد نايلون خلي على الطفل covering all his body just his head. Sorry. Now the lung of preterm infants are especially prone to injury from positive pressure ventilation due to volume. So when I give the high inflation اللي هو full inflation ايش تعتقدون هذه the lung of the baby are fragile so they may have pneumothorax. So how can I overcome this problem? Using the TPiece. تذكروا TPiece. Using the TPiece device for resuscitation اللي هي ممكن تنحط يعني applied over a mask directly to the baby or اقدر اربطها وين؟ بالامبو باج. هاي ايش راح تسوي لي؟ هاي راح تسوي لي steady level of pressure. ما راح يصير high pressure لان يمكن اني اسوي increase and decrease the pressure. هاي راح تخلي لي وراح تشتغل شغل يشبه السي باب. هذا تشوفون التي بيس طالع منه اقدر يعني هي تربط بديفايس عمليه معقده. ممكن انه تنطي intermittent positive pressure ventilation. احط ايدي اشيلها like the Ambu Bag. يعني ممكن اشيل Ambu Bag اذا ما احتاجها وبالمقابل استخدمها على مود اتاكد انه البريشر it will not harm the lung. زين ممكن ايش احتاج؟ ممكن من البدايه اخلي البيبي اون سي باب. بعد هذا البيبي يحتاج احنا شوفوا زي ما قلنا امبو باج المفروض تسالوني سؤال شو هاي ما قلت لنا شنو هاي وين تربط زين this may be connected to auto source احنا عاده ما نحتاجها زين the atmospheric air is enough لكن in pediatric and preterm babies نحتاج نربطها باوتو is not enough. زين نعطي ال concentration of O2 is about 30 to 40 centimeter of water. ما نعطي high pressure. ليش؟ احنا ما نستخدم ال O2 دائما وما نعطي high pressure بالبيبيز. To get rid of the toxicity of O2. O2 is a drug. تعرفون هذا الشيء. Is a drug like any drug. So it has toxicity, especially for the preterm babies. شو يسوي؟ preterm babies شو يسوي بهم؟ يلا يسوي روب. شنو هي الروب؟ خضراء بطنها حمراء وبيها وباذنجانها طلعت. Retinopathy of prematurity. زين؟ Retinopathy of prematurity. It is of prematurity. ما تصير بالterm babies. لكن the high risk factor to develop it شنو هو؟ الأوتو. So we should avoid the hyperoxia. ما نكون يعني والله زود الأوتو على مود يزود الأوتو saturation. No, this is not the rule. زين. بعد infants less than 27 week of gestation. هذا من البداية it's better to start with intubation and infuse of surfactant. لأن هذا تتوقع أنت ما راح يصير عنده response because of the surfactant deficiency and you should give it the surfactant من البداية. بعد عندنا consideration. The volume expander should be used, infused slowly more than in-term baby على مود نمنع rapid swinging in the blood pressure. These are the preterm baby considerations. إذا نروح علما هسه نروح للناركوتيك depression. شنو هو narcotic depression? What is the narcotic used in labor? Pethidine, morphine. زين. Pethidine used for the تعرفون painkiller. زين. So this is can go through the placenta. يسوي لنا respiratory depression. أولاً this is unlikely to be used. يعني just in a few circumstances. Firstly, شلون بنقول هذا has a narcotic depression؟ لما نشوف البيبي heart rate is normal. His color is normal. His activity is normal. لكن ال breathing ما تشبيه deficient. So we should think this is because of narcotic. لأنه إذا كان the breathing deficient or inefficient لازم وياها الهارت ريت لو، الكلر بعد ساينوس، التون شبيها low decrease. نشوف all these parameters are good or responding. خلينا نقول إنه mild بعدين responding. But the respiration is still impaired. So should I think because it's narcotic depression? And the narcotic depression, I should give the antidote for which is naloxone. But this should be given within 4 hours. The dose is 0.1 milligram per kg, either IV or IM. This is maybe indicated, but مشكلة شنو? After time, ممكن البيبي راح يرجع to develop the respiratory depression again. So it is just a time limited. واحدة. الشغلة الثانية, this is fortunately not available in our society. If the mother is addict or narcotic, so I should not give it. Why? Because this will lead to withdrawal. هذا الطفل المother هي narcotic addict فمتعود عليها هو يعني during the entire child life. اجانا نعطي naloxone راح يسوي withdrawal. So it will have an adverse reaction. So this is the narcotic depression. Now, the meconium stained amniotic fluid. مرات يجي الطفل عنده meconium stained. تعرفون شنو الميكونيوم؟ زين؟ يعني baby passed the first meconium while he is inside the uterus. ممكن يكون thick meconium يصيحوا له بالobstetrician. Thick meconium يجي stain the fluid and of course it will stain the body. نشوفها ممكن على الفيس، ممكن نشوفها على الامبليكلز، نشوفها بالfingernails، زين. ممكن نشوفها وين؟ inside the mouth. Not fortunately, lesser incidence or ratio of meconium stained amniotic fluid causing meconium aspiration. يعني مو كل طفل نلقاه meconium stained هو صار عنده meconium aspiration. Just a few proportion of them. اوكي؟ زين. هسه meconium stained amniotic fluid اجى الطفل. شنو اسوي له؟ هاي هنا الأوبستريشن لازم يتدخلون. الأوبستريشن يقول perform routine suctioning of the mouth and nose after birth. يعني هو أول ما طلع من يمه قبل لا يسوي warming, drying، لازم شو يسوي؟ routine suctioning. من يومهم هم لازم يسوون. ومرات يقولون إنه just the head out of the birth canal ويشوفوا meconium start go if the infant is active and breathing and require no resuscitation the airway need not to be inspected. يعني هو الطفل عنده meconium stent مو بس انا دا اشوفه active breathing ما يحتاج resuscitation ماكو داعي انا اسوي inspection for the airway واسوي extraction of the meconium ما يحتاج زين ولذلك تقول انت تذكرون قلنا clear airway if necessary زين if necessary زين but the airway of any depressed infant requiring ventilation هسه لا هذا عنده depression he cannot take a breath or just gasping and breathing وهو عنده meconium stent هذا شنو معناته؟ ممكن انه meconium inside his airways فأنا before doing the positive pressure ventilation لازم شو اسوي؟ I should check the airways اشوفها واسوي thorough suctioning لانه بالpositive pressure ventilation وين راح تروح؟ go deeply inside the lung. So this is the special consideration. Now avoid hyperoxia. قبل شوي حكينا عليها. ليش؟ No need to give high O2. Especially in a preterm newborn قلنا should begin with 30 to 40%. We should know the target oxygen saturation. احنا قلنا pulse oximeter مو؟ من يجي اباوع ما اتوقع انه انا saturation it will be more than 90 or 90 at 1 or 2 minutes. There is a time for the response or for increasing of the O2 saturation. So I should know it. يعني القى 30 minutes او القى 2 minutes والقى saturation مالته is 70. This is normal. ما اقول هذا hypoxic. لا it will take time to respond. لذلك لازم اعرفها. When اسوي checking of the target oxygen saturation, it should be on the right side because this is a predictal. لأنه ممكن اكو شنو؟ dectus arteriosus still open. وش يسوي لي mixing of oxygenated deoxygenated blood. So real assessment is on the right side. فلذلك avoid الهايبروكسيا. إذا عرفت أنا target oxygen saturation ما أضطر أزود ال O2. زين؟ especially in preterm babies على مود يصير لي level more than 90. زين. هسه احنا قلنا هو objective. تمام ولا لا؟ شنو هي الميجرز to continue the resuscitation؟ يعني استمر لا اتوقف. طبعا الابجار سكور اللي حكينا عنه خليني اسالكم سؤال. Can the Apgar score predict the outcome of a baby, the long outcome? ممكن مثلا اذا لو Apgar score at 5 minutes مثلا هذا اتوقع الطفل راح يصير عنده مثلا hypoxic ischemic encephalopathy وراح يصير ممكن عنده CP mental retardation وراح اطلع اقول له والله ترى هذا يعني تعبان اموره فممكن بالمستقبل يصير عنده هيك شيء او اكيد راح يصير عنده هيك شيء. Can I predict according to Apgar score?
No.
The answer no. Apgar score is an indicator of the response to resuscitation and the need for further steps of resuscitation. It cannot predict the long-term outcome of the baby. So avoid judging on the baby from Apgar score. هاي بالنسبة لأبجار score. هسه continued resuscitative measures. يعني استمر لا لا. شوفوا. يقولون resuscitative efforts are made even in apparent stillbirth. Apgar score at 1 minute is 0 to 1. هذا لازم نسوي له resuscitation. stillbirth تعرفون شنو هو؟ مو؟ بس أنا قاعد أقول apparent stillbirth. يعني لا تون، لا breathing، كلام مالته بلو، heart rate مدى أسمع، زين؟ apparently dead. Apgar score مالته أقدر أقول 0 to 1. I should start resuscitation. ليش؟ لأن modern resuscitation techniques improve the survival in such infants with 60% of survival showing normal development. Apparently dead baby. At 1 minute time. ممكن انه 60% من عندهم شيء يعيشون normal. زين؟ فهذا لازم اطول خلق وياه ولازم start resuscitation. لكن نرجع للأبجار سكور وأهميته. If Apgar score doesn't improve markedly in the first 10 minutes of life, فلازم أنا شو أقول؟ The mortality and the incidence of severe development يعني morbidity among survivors are high. هاي شلون أنا أسوي لها assessment؟ This is need further and follow up and evaluation time by time until reaching to the age of 18 months. يعتبر هذا critical time of age. نشوف انه الطفل صار عنده developmental delay, handicaps, mental retardation or CP. زين. Discontinuation of resuscitation. هسه عرفنا وين نبدي وين نستمر. طبعا discontinuation of شو وقت نستمر؟ أي نقطة ممكن نستمر بالresuscitation. There is no time, clear-cut time for stopping the resuscitation. But universally, they are agreed on 20 minutes. دائما هذا time 20 minutes is يعني most likely agreed from all centers. لذلك تشوفون الأبقار سكور قلنا ممكن يكون آخر واحد بيه شنو هو 20 minutes. هسه discontinuation of resuscitation قررت أوقف الريسستيشن أو بالحقيقة مو بس أوقف الريسستيشن. شوفوا هذه. The outcome of baby with no detectable cardiac output more than 10 minutes is likely to be very poor. يعني أنا بديت resuscitation. أوكي. apparently dead baby 1 minute ما عرفته. مو؟ لكن بديت resuscitation وما شفت detectable cardiac output. مدى أحس أكو cardiac output؟ لا الستيثوسكوب، لا الساتوريشن اللي يعطيني اياها مثلا، لانه البازوكسيمتر يعطيني هارت ريت، تمام ولا لا؟ more than 10 minutes، شو اتوقع؟ اتوقع انه يكون very poor. From this point I may discontinue. There is no detectable heart. I may discontinue the resuscitation. زين. هسه اكو عندنا situations we can stop the resuscitation or we didn't start resuscitation from the beginning. شنو هي هذه؟ ممكن ما نبدي اصلا resuscitation. Extreme prematurity, less than 23 week of gestation. تتذكرون احنا قلنا preterm labor mentally when completed the 22 week of gestation. The latest or the update definition for preterm labor. If it is less than 23 week هذا extreme prematurity. Extreme هي بادية من ال 28. هذا extreme prematurity. ممكن ما ابدي له. زين؟ resuscitation اصلا. birth weight less than 400 جرام. معجزة ان يعيش، مو عندنا. لكن معجزة ان يعيش البيرث weight of less than 400 جرام. ليش اسوي resuscitation؟ lethal abnormalities like what؟ anencephaly. يعني respiratory center lost. وين راح يصير response؟ or انتبهوا confirmed trisomy 13 or 18. اول شيء confirmed يعني antenatal مسوين كريونيك فيلا سامبلينج وطالع trisomy. لكن وش trisomy؟ 13 or 18. زين 21 ليش ما حطوه؟ ممكن يعيشون ويسوون يطبون المدارس وممكن يشتغلون فما اجي اقتلهم اني. زين؟ لكن 13 and 18 الميديان لايف expectancy مالتهم ممكن يجي just a few days after birth. If it is confirmed from the beginning, I may not start the resuscitation. And if there is, شوفوا هاي النقطة, if there is no breathing effort whatsoever after 20 minutes. يعني شنو معناته؟ 20 minutes استمريت 20 minutes ما حصلت أي breathing effort. أوقف. أو only gasping respiration after 30 minutes. أوقف. 10 minutes وين هذه؟ no detectable heart. فمن لقيت الهارت طولت خلق أكثر. وصلت ل 20 minutes. إذا متى أشوف breathing efforts whatsoever شنو معناته؟ يعني كل ما سويت ما حصلت شيء. زين. now خلصنا احنا بس راح نسألكم فديسة خلينا نشوف أجوبتكم. birth outside the delivery room. كل اللي حكيناه هو ال guidelines of the neonatal resuscitation at the hospital. وين بالهوسبيتال؟ بالدليفري روم اللي هي لازم supplied with equipment مهيئة زين for the resuscitation. Now, if the birth happened outside of the delivery room, وخلينا نبدي بداية منه بالهوسبيتالز. ممكن يصير بالهوسبيتالز بالامرجنسي ديبارتمنت، جت كذا وحده بري تايم ليبر مثلا او صارت ليبر ما راح اقرا عليها. زين. هنا while she is in the the hospital, guidelines of resuscitation should be followed or performed as much as possible. And at hospital راح يتعاملون وياها هم منو؟ doctors, nurse, so they are somewhat trained. بعدين شو يصير بي؟ post resuscitation transfer of babies. زين. يعني منو تجي هاي؟ كيا. قلنا عليها الورد ترانسبورتر ايزوليت. يجي دورها تنقله وين؟ توديه للان اي سي يو. زين. اذا صارت الدليفري at home. At home unexpectedly happens outside at car, yeah, market, أي مكان. The principle of resuscitation are identical to the hospital setting. لكنه تعتقدون أنه at home they can't perform it in the same way? Of course not. Then هاي واحدة. اثنين, the transport will need to be discussed according to local guidelines. Transport همنا ما يخضع. هذا جاب سيارة، هذا جاب ستوتة، هذا تأخر يلا إجا، تمام لو لا؟ هذا كان uncovered من إجا. شنو البروبلمز اللي ممكن يواجهها البيبي؟ أهم مشكلة، خل أسألكم هذا السؤال. أهم مشكلة تعتقدون راح يواجهها البيبي it will worsen his condition if he is delivered outside of the delivery room. Very good. شنو هاي؟ وردة. هايبوثيرميا. هاي المشكلة الأهم. زين؟ والهايبوثيرميا عرفتوا شنو هاي؟ هايبوثيرميا. فشو تسوي أنت؟ إذا ما تقدر تسوي ريسوستيشن. باكر سألتوا البنات قاعدين مقيمات في طوارئ نسائية. برادة تصير هاي الحالة. أهم شيء شو تسوون؟ لفون الطفل. أهم شيء. لفون الطفل. دفون الطفل. زين؟ هذا أهم قضية تقدمون هي ممكن تفيده. Transport him to the يعني resuscitation point or resuscitation place.